Hello, this is Dr. Li. I'm from Kaiser Medical Center. Welcome back to my channel. Today, let's continue our topic in soft tissue and bone tumor of head and neck, part 3. The first entity we're going to talk about is teratocarcinosarcoma. So from the name, you already know that this is malignancy with immature and malignant endodermal, mesodermal, and neuroepithelial element resembling immature teratoma. And then one characteristic finding is SMARCA4 loss. So basically, you will just find this heterogeneous neoplasm with different kind of component. Like from this image, we can know this forming this granular structure and then spindle cell sarcomatoid component. These two just mix together. Then here in the left side, we can have this squamous cell differentiation with this clear cytoplasm and then merge into this small round blue cell almost forming like neural matrix and neural component, mimicking kind of immature teratoma. Because from the immature teratoma, we always need to look for this immature neuroepithelial component. Another one also we can show this immature neuroepithelial forming this rosette. So whatever thing forming this rosette, we need to think about this immature neuroepithelium. If there is no other component, we need to think about whether this is a small round blue cell differentiation, including all kind of this blastoma, neuroblastoma, medulloblastoma, retinoblastoma. Another one we also show this immature neural epithelium forming this rosette or pseudo rosette. And then we also have this granular structure and then some sarcomatoid spindle cell component. For the mesenchymal differentiation, sometimes we also can see this chondrosarcoma area mixed with this immature neural component. So this teratocarcinosarcoma. So the immuno staining just highlight different plaque like epithelial component. We will see cytokeratin positive, spindle cell, sarcomatoid component. We can see some muscle differentiation, some neural, and vimentin. Then the characteristic I think we need to remember is loss of SMARCA4. Another name for SMARCA4 is BRG1. The differential just other kind of blastoma, rhabdomyosarcoma, and other undifferentiation high-grade carcinoma. Even germ cell tumor is a really good mimicker. The next entity we're going to talk about is giant cell tumor of head and neck. Basically, I just thinking this is fall into the giant cell tumor category, like giant cell tumor of the bone. They can share some common feature. So I think if the image show you a giant cell, a lot of giant cell, you may think about this entity. But I just like to remind you that not all the giant cell tumor with tons of giant cell. So you need to remember another characteristic finding really unique for this entity is this mononuclear stroma cell with a monotonous appearance. So I borrowed this image from Dr. Jerry Gardner's channel. I think he doesn't mind. I borrow this image. He's my great mentor at Kaiser Medical Center. So I think most of you guys already subscribed his channel. So this is the mononucleus histiocytoid cells I want to show. It's really nice they have eccentric nucleus, and then with this eosinophilic cytoplasm, always mimic kind of some rhabdoid, histiocytoid looking. And then they also have this characteristic hemosiderin deposition. So this is the characteristic of giant cell tumor. If you could not find tons of giant cell, you need to find this mononuclear cell. Another feature is this foamy histiocyte, also support the diagnosis. Then we have this sclerotic stroma, another characteristic finding. And then again, highlight this hemosiderin. So the immunomarker is not really specific, but right now we have kind of specific mutation. This histone 3 protein, we find this gene mutation H3F3A G34W mutation. So let's see some image. Okay, so this is giant cell tumor. So let's see this piece first. Kind of well demarcated mass. So we may think of kind of benign entity. Then for the giant cell tumor, of course, we would like to see the giant cell first, right? So let me find some giant cell. This focal area, even in this power, we all can see this giant cell. But really nicely, we also see our friend, this mononuclear cell. See, they are everywhere, even more than the giant cell. So they have eccentric nucleus, and then eosinophilic cytoplasm. And then when you see the nucleus, put this nucleus into the giant cell, they are the same. So this is giant cell tumor of the bone. What you should recognize is this histiocytoid, plasmacytoid cell, mononuclear cell. And then let's find other feature. Even in this power, we can see this really sclerotic collagen background. Then we have this foamy histiocyte, really foamy looking histiocyte, supports our diagnosis. And then we also like to show you one more feature. I think this is hemosiderin deposition, another feature. And then one more is that sometimes you will see this cohesive mononuclear cell. See, this is also mononucleus, eccentric, rhabdoid, plasmacytoid looking, and then they forming this kind of this cohesive area. So this is another characteristic finding. The example is really good because we can see all of these foamy histiocytes. So if you don't see giant cell, but you see these, you need to looking for these mononuclear cells. So this is a really nice example of giant cell tumor. Let's move to another entity. Aneurysmal bone cyst. So remember USP6, that's really characteristic. So when I talk about this kind of bone tumor, I always like to show this image, because when you remember this image, before you look at the slide, you already have your differential, because we know that bone tumor, we already divided into two age groups, less than 30 years old and older than 30 years old. And then also the location. From the bottom to top, we have epiphysis, then metaphysis, and diaphysis. In a younger age group, if in the epiphysis, we will think about chondroblastoma. And then in the metaphysis, osteosarcoma, ABC, this aneurysmal bone cyst. And then going upward to the diaphysis, we have Ewing sarcoma and osteoma. Of course, in the metaphysics, we also have osteoid chondroma. Then if our older age group, from the epiphysis, we have this giant cell tumor we just talked about. And then we have endochondroma, chondrosarcoma. So just remember this image, and then you can have your differential. So we are going to talk about ABC now. So the growth image, we can see kind of a soft tissue mass growing out from the bone. We have this multiloculated area and then thickening septate. Then we can see this black lake lagging in this space, but this is not a true lumen. Then we have this sclerotic stroma, almost like osteoid looking, forming some immature bone, kind of reactive. Then we can see multinuclear giant cell, mitosis, and then all kind of this spindle cell. Just show you this giant cell with extravasated red blood cell. Then let's look at a really nice virtual slide. So this is aneurysmal bone cyst, low power. We already can see this multiloculated area and then this hole. This is pseudocyst area. So let's look at one area first. We have kind of hypocellular and hypercellular area. And then this hypercellular area, what do we see? See, a lot of giant cell. So if you just show me this image, I can see giant cell, and then maybe I can hallucinate some mononucleus histiocytoid cells, and then I will think about giant cell tumor of the bone. However, when we look at the low power image, we know that not all the rare area like this. We already have this multilobulated, loculated, and then this pseudocyst. So this is not giant cell tumor of the bone. Then you still remember I talked about USP6 in this entity, because another translocation with USP6 in the soft tissue world, that is nodular fasciitis, that is MYH9 USP6. So both ABC and nodular fasciitis had USP6. So we will find some area kind of mimicking each other. Like this area, this spindle cell proliferation do not form any structure. They have some inflammatory cell like lymphocytes in between. So, and this spindle cell mimicking this so-called tissue culture light area. So this spindle cell just have this spindle, small string out, look like some fibroblasts in the tissue culture plate. If you have ever do any ex vivo culture, you will see the fibroblasts growing like this. So this only this high power just mimicking nodular fasciitis. But again, the whole structure is nothing like this. So let's talk about this multiloculated cyst area. One characteristic finding is that around this pseudocyst area, we can see this sclerotic like bone material, osteoid material. They just surround this pseudocyst. And then they also intermingle with this nodular fasciitis spindle cell area, and then trickling around this pseudocyst. So this characteristic. So go to low power, we just do a quick recap. And the aneurysmal bone cyst you should find in the metaphysis of a younger age group. We have this multiloculated pseudocyst area in low power. We can find some giant cell tumor like area, but just really focal. And then in this cyst area, pseudocyst area, we can find this cyst wall. We have this tissue culture line almost mimicking nodular fasciitis area, and then intermingle with this sclerotic, osteoid, stroma, just hugging around this pseudocystic area. So combine all of these features, that is aneurysmal bone cyst, the transfusion, remember USP6. Okay, the last entity I'm going to talk about is the osteoma. So osteoma, just like normal mature bone, there are 3 tissue types inside this entity. So in the peripheral area, we will find compact mature bone, and then underlying this bone, we will find fibrovascular stroma. But just bear in your mind, you could not find hypercellular area in the stroma. All the stroma like loose fibrous stroma. And then of course we can see fibroblasts rimming the bone. So basically we just see some bone formation in the soft tissue part. This is the mandible. Then we can see this really nice mature lamellae bone. So that is forming this round area. So this is mature bone. And then this is the stroma I mentioned. You always need to focus on this area when you find this mature bone in the dermis. This is skin. So really hypocellular, loosely fibrous stroma. Here just shows some osteoblasts rimming around the bone, but nothing hypercellular. Just loosely fibrous stroma with this mature lamellae bone. Another really nice mature lamellae bone, and the stroma is really loose, almost edematous. You can think really whitish area. That means not a lot of cell. Another thing showing the same thing. Then one major differential you need to think about is periosteal osteosarcoma. So basically, first, the bone is not mature bone. We do not see that really nice lamellae, and then a lot of nucleus here. And then more characteristic is this hypercellular stroma, tons of this spindle cell. You won't see osteoma has that many spindle cell rich stroma. So this is periosteal osteosarcoma. And then characteristic finding is nuclear staining of MDN2. So I think that is the conclusion of this soft tissue and bone tumor in ENT area, part 3. Thank you for your attention.